One of the things that fascinates me the most is neuroplasticity, the idea that the physical structure of the brain changes in response to experience. By using brain scanning technologies, neuroscientists can see which parts of the brain are active when someone is performing a certain action, thinking a certain thought, or behaving in a certain way. The more scientists learn about how the brain functions in different circumstances and how it changes due to experience, the more we'll be able to develop methods to help people change the structure of their brains for the better. This new field of applied neuroscience will enable scientists and practitioners to create new methods and technologies to help people across many disciplines. For example, by creating more effective teaching methods, better methods for mastering a skill like playing violin or doing mathematics, or even treatments to improve or cure mental illness. Historically, psychiatrists and psychologists have tried to help people suffering from mental illness, either through some form of psychotherapy, psychoanalysis, or with drugs that act on the brain. Now, for the first time, psychiatrists and other practitioners are developing targeted therapies based on a clear understanding of what goes wrong in the brain of someone suffering from a mental illness. One of the first scientists to develop this kind of therapy is the psychiatrist and neuroplasticity researcher Jeffrey Schwartz at UCLA. Dr. Schwartz has used brain imaging to study the brains of people with obsessive compulsive disorder, OCD. These are people who suffer from obsessive thoughts and behaviors that they cannot stop. For example, a person who has to go back 100 times or more to make sure that they turn off the gas before leaving the house, or someone who is obsessed with the fear that they will contract a terminal disease. What Dr. Schwartz discovered is that the brains of people with OCD are actually locked in a certain neurological loop, which is why he calls OCD brain lock. You can think of it like a deep thought groove that has been carved in their brain from which people with OCD can't free themselves. By understanding on a neurological level exactly what is happening in the brain of someone with OCD, Dr. Schwartz was able to develop a simple cognitive therapy that a person with OCD can apply to themselves and that uses the principles of neuroplastic change to replace the old negative loop with a new positive pattern, enabling the patient to become free from OCD. Dr. Schwartz has also compared the brain scans of people with OCD before and after undergoing treatment, and these brain scans showed that the structure of their brains actually changes as a result of the treatment. So for the first time, we have both a therapy to treat mental illness that is grounded in neuroscience, along with the proof that the treatment actually works by changing the structure of the brain.